So, to determine if the plan to promote independence in elderly healthcare management through technology is working, we can monitor various indicators or markers of success. So, these indicators will help us evaluate both the adoption and the impact of the technology on the elderly's health and well being. So, number one would be the device and application usage rates. So, the indicator would be the frequency with which the elderly individuals use the health management devices, such as their blood glucose monitoring or their BP monitoring machines, and any applications that they use. To measure this, we would use the logs from the devices or the apps, the number of active users, and the duration of each usage sessions. Number two would be user engagement and the user satisfaction. An indicator for this would be the level of interaction with the technology, such as how often they log or the health metrics or participation in telehealth sessions. To measure this, we would use data analytics on user engagement, the frequency of data entry, and participation rates in virtual health activities. Number three would be your health outcomes. So, an indicator would be there would be an improvement in health metrics such as the patient's blood pressure, glucose levels, and any increase in their physical activity. And to measure this, we would use regular monitoring and a comparison of health data before and after the technology adoption. There would also be a reduction in hospital visits and readmissions. An indicator would be, of course, the decrease in the number of emergency visits and hospital readmissions. And to measure this, we can look at healthcare records and reports comparing rates before and after the technology implementation. Number five would be self-reported independence and confidence. So, an indicator could include an increased feeling of independence from the patient and confidence in managing their own health. To measure this, we would probably use surveys and interviews with the elderly individuals regarding their confidence and independence in their healthcare management. And lastly, we would look at the quality of life improvements. So, an indicator would be that there is overall improvements in the quality of life as perceived by the elderly. And to measure this, we can use comprehensive surveys and interviews, just assessing various aspects of life quality, including physical health, mental well being, and social interaction.